medications like famotidine, ranitidine, which is one we see very common, cimetidine, it's recommended that you take it 30 minutes before your evening meal, okay? And why we want to do that? Because before your evening meal, it will control the secretion of the stomach acid, both after and during the critical overnight period when the secretion reaches its peak. Because remember, I tell you,
from 10 to 2.
From 10 to 2, it's highest from 10 to 2. So making stomach juice is less likely to irritate the esophagus. So you want to take it at least 30 minutes before your evening meal, particularly if it's a one a day. If it's twice a day, you do breakfast, you can take it 30 minutes before breakfast and 30 minutes before dinner. So remember that the pH in the stomach is about 1 to 3 when it's empty, and when it's full, it's about 5. So I gave some examples of the high levels of the type of foods like orange juice that we like, the vinegar, coffee, water, what level pH they are in the stomach. So we can now determine, okay, maybe I should drink more of water to kind of neutralize the amount of acid in the stomach. But we're saying that if you have heartburn and you're using stuff like ranitidine, the better time to do that would be 30 minutes prior to.
So if you're suffering from heartburn and you take coffee and some of the others high in acid, then you have a bigger problem.
Yes, because it will definitely add to the
acidity,
to the acid production and aggravate the situation even more. So it's critical if you suffer from that condition to know what the foods, the fruits and vegetables that you eat, the acid content within that.
Okay, and talking about fruits, for the past past year or a few months, I've been hearing that it's better to take your fruits on an empty stomach. Some people eat it as soon as they eat, they say, that's my dessert. That's not good to do.
I would not particularly say that. Based on the mechanism of how these things act, if you suffer from heartburn, then if you need to take your fruits, look at the type of fruit that you're taking to see how acidic it is.
But
so definitely it would not be right to take it on an empty stomach.
Oh, for if you suffer from heartburn.
If you suffer from heartburn.
But generally it would be better.
Well, that's what they
stomach.
say. Well, that's what they say. The mechanism
seems to be saying.
Yes, the mechanism may be because of better absorption. In most cases, if you're taking something before eating or without food, like heavy food, it basically is for better absorption. So that might be the rule of thought behind that. I haven't actually read that research, but it could be because of the absorption of the drug. It doesn't bind to anything else. The food, the content of the food, the amount of food in the body could bind the drug in that fruit and just cause no reaction. It just breaks apart, falls apart.
Right. On the other hand, if stomach is already filled with all those acids too, and you add more fruits with more acid, then you may have a problem.
And if you have ulcers, you already have irritation to the lining of these areas in the digestive tract. So that acid is going to erode the lining even more, causing that intense burning and discomfort that you get when you suffer with heartburn. So you want to pay close attention to the type of foods that you eat. Ask your doctor, ask your pharmacist, ask your nurse or the healthcare providers, because a lot of people suffer from that condition, but they still continue to eat the same way, even if they are on medication. So it's important to know.
Medication will not change your situation unless you combine that with the change
of lifestyle and your diet. Yes. Because what it's going to do is at the point in time, it's going to stop the production of the acid. It's going to bind that secretion that is just too much for the stomach at that point. So that is what it's going to do. But if you continue eating the same way, type of foods, quantities, certainly that would help aggravate the situation.
That goes for situations like when people say, well, my family is fat, my mother is fat, because you all eat from the same pot, the same style.
Yeah, what you eat.
All right, you eat the same foods like your mother.
Yes, exactly.
Not necessarily a genetic thing.
Yes.
But because you eat the same amount of fat and like your fat meat and all that stuff.
Yeah, genetics have a part to play in it, but you also have a part. Also have a part to play in it. It's what you believe in as well. It's critical to who you become. You understand? So it's not because, like I will say, oh, cancer is in my family, diabetes is in my family. I do not like to hear people express themselves like that. It's not because
that's negative.
it's a negative thought. So you already prepare yourself. You've just let loose.
Happy too.
Yeah. So why?
Just waiting for it to happen.
Just waiting for the time to come.
But words are powerful.
Very much. The Bible tells us life and death is in the power of the tongue. And you have to believe that. When I first heard it as a child growing up, it didn't make much sense. But now I know how important that when you speak words, you have to choose. Yes, you have to choose the words that you need to voice. Sometimes when you recognize what you're saying, you have to almost
reject it,
right away. Yeah. So I don't think it's because, say, my family, we have that issue with high blood pressure and diabetes. No.
You got to reject that.
You have to do that, and you would
your
take
family
steps.
Had burn. You reject that.
Yes. Take steps. Today is not like years
ago
with our great-grandparents. I tell them that about, for example, like the bush teas that we drink. The content of these herbs are not the same today that they were yesterday. You take a few leaves of Simekotwa, for example. It has absolutely no flavor compared to the Simekotwa that my grandmother gave me to drink. The smell, the aroma, it's not there. So the content is different today. So when you say, oh, I'm just going to drink my bush tea, you take 10 leaves, 6 leaves, 20 leaves, you're not sure what you're doing. Because of gain of the ozone layer and the destruction that we have, the content, the percentage of the drug within the 2 leaves could be higher than 6 leaves. You understand? So you might be destroying yourself, or vice versa. The opposite is true. So you want to be careful when you do those things. In the lab, what they do is to create the same thing that you have, but it's under control. But this is another discussion. Some people may not agree with me, but that's another discussion that we can take up another time.
Ladies and gentlemen, we're looking at timing and your medication and how that affects your medication, your good health too.
Yes.
And so we continue, Martha. We're looking at another one.
So we're going to look at asthma. We've seen research has shown attacks of about 50 to 100 times is more often between 4 o'clock and 6 o'clock in the morning.
For people with asthma.
Than during the daytime, yes, for asthmatics. So we have attacks much higher around 4 a.m. to 6 a.m. than during the normal daylight. About 4 in 10 persons might wake up at the night with trouble breathing. So we want to know when is the best time to take your medication. For the oral medication, for example, like Ventolin liquid.
But before you continue, why is it that most people or research has shown that many more people get attacks between 4 and 6?
It could be because at that time of the night, the body is sort of repairing itself. And you're involuntarily less in control of what's happening, what's surrounding you. You understand? You're relaxed. You really don't know what's happening at that point. So you're not able to shy away or move away from stimulants that might cause or could cause an inflamed situation, and you sense that that's coming onto you. You understand?
In a normal situation, when you're up, you can say, let me come out from there, the smoke in there, or the whatever, something in the
whatever
air.
Stimulant is
but
there.
You're sleeping.
Yes, but you're sleeping and the body is repairing itself, and for other genetic reasons as well, because you're asthmatic, you don't breathe normally. You're easily affected by the stimulants out there. Nighttime is a time, during that time, early in the mornings when the pollens are blowing all over the place. You know, the air is much cooler at that time.
I'm going to say that.
Yes.
It's a little colder.
So, right. So there are a combination of things that could cause that to happen at that point at time. But we're talking about asthmatic individuals. We're not talking about people that are non-asthmatic. So let us not think that it happens to everybody. We're looking at people who suffer from asthma. Okay, which is that breathing condition.
So you're saying the best time to take your medication would be?
So the best time when to take it, we are saying that if you're going to use the oral form of the medication, which is, for example, like the Ventolin, you're going to give the liquid form, we're saying the best time is mid-afternoon. And for the inhaled steroids, the best time is late afternoon. So what that does, it helps to reduce the inflammation that can happen and relax the air passage while taking away the effect when the asthma attack is most likely to strike. Okay. So for example, a single dose of an inhaled steroid in the afternoon helps prevent asthma trouble at nights. Ventolin for attack, remember that. Ventolin for attack, because a lot of people don't know that. Ventolin is for the attack. Bicotide, I'm using those two because they're the pretty most common ones in Dominica. Bicotide for maintenance. Inhaled, for example, the Ventolin or the Bicotide, in the inhaled form, it goes straight into the lungs. Any form that you take when you inhale, it goes straight into the lungs. The oral, which is like the liquid or the tablets, is absorbed into the body. Okay? The steroid reduces the inflammation. That is why it is for maintenance. So it reduces the possibility of getting that inflamed lining. And the salbutamol, which is Ventolin, they are bronchodilators. What they do is to open up the air passages. They dilate it, they make it bigger so that the air flows in freer with no obstruction.
And that is why people sometimes have died when they haven't got their Ventolin.
Yes, because the area constricts. The air passage constricts. It gets smaller, tighter. So the blood which carries the oxygen is not available to go into the air passage. So they open up the air passage in the lungs, allowing for a better airflow. So be mindful of the frequent use during an attack with no resolution. So if you're constantly using Ventolin, especially when you have an attack, and you're getting no resolution, you need to see a doctor or you need to go to the emergency department, because it could be a situation where the constriction is just not allowing for dilation. So they're going to have to either nebulize you or to find some other reasons. Like I just had a patient who has been asthmatic for a while, and with the change in the atmosphere past after malaria, constantly had that wheezing and thinking, okay, well, I need my medication because it's my medication, but only to find out she needed to be nebulized. She thought she needed to be nebulized because the Ventolin wasn't helping, but upon examination they realized there's a little clot forming in the lung preventing the air passage from dilating. So no, they had to treat her for that. So it wasn't really the asthma. You understand? So that is the reason I have here, be mindful of the frequent use of your Ventolin, particularly the Ventolin or other asthma medications for attack, for acute attack, meaning attack that comes on right away. If you're not getting no resolution, you need to check with your doctor. But you have to remember to be on the steroids that are for maintenance every day. If the doctor say, okay, well, I want you to take it for the next 3 months, every day. It's every day, once a day. That is to reduce the inflammation that will
Don't
cause...
just take it when you feel bad, like some people do with medication.
You cannot do that. You do that with the Ventolin because it is for
for the
attack.
particular, for an attack.
Yes, but the Bicotide, for example, is one of the steroids we commonly use in Dominica, so that's why I'm using that example. Bicotide is to be used every day for as long as your doctors say you need to use it, because it's for maintenance. It keeps the lining down, so in the event of
less attacks.
Right, in the event you're exposed to a stimulant out there, you don't get an attack.
And that's the same case too for people who have depression or other diseases. Some people take it only when they feel bad.
When they feel bad.
And that is not right.
That is not right.
All right. Well, that's our program for today. Tablets and spoonfuls. Hope you learned something today that will help you. And we'll continue next week looking at timing, when to take your medication, when it's most effective. You could be taking your medication, but at the same time, taking it at the wrong time, you will not get all the benefits of the medication. So we'll look at that again next week on next week's program. Till that time, the number to call, any questions, call 440-8600. Quick Care Pharmacy. All right, we wish you a happy new year, a blessed new year, a year full of health and strength, and that you will overcome all your troubles, all your problems, all your issues in 2018.
Amen.
Felix Anderson
and Martha Augustus.
Bye now.